Hello, Colin Hung for Healthcare IT Today. And I'm about to sit down with Dr. Tim O'Connell. He's the CEO and founder of a company called Emtelligent. And they're using AI to help bring structure to unstructured clinical data. They're reading PDFs, translating that into codes, and making that available to clinicians and anybody else who might need that. I'm going to ask him about how he's deploying AI and how they're balancing the need for data with patient privacy. Let's get to it. Dr. O'Connell, welcome to the program.
Thanks, Colin. It's a pleasure to be here.
Yeah, it's great to have a fellow Canadian interviewing you down here in Las Vegas, two Canadians together.
Absolutely. I brought my maple syrup with me.
That is a mandatory travel advisory,
Oh,
right?
absolutely. Well, you can't cross the border without it.
We got to put it on everything we have down here.
For sure. Hamburgers, steaks, everything.
Now, Dr. O'Connell, before we dive into a little bit about what your company is about, can you tell me a little bit about your background and how you got into healthcare?
For sure, Colin. I did an undergraduate degree in neuroscience many, many years ago, and that really piqued my interest in healthcare. But, way leads on to way, and I ended up becoming a network engineer. And then after doing that for a few years, I was like, well, I should go back into medicine, and ended up becoming a physician. And now I'm a practicing radiologist, and I work clinically 1 to 2 days a week and spend the rest of my time with the team at Emtelligent.
So you're an engineer, you're a radiologist, a practicing radiologist, and you're a company founder.
Yep, it's a busy lifestyle, but it takes a village, and I've got a lot of great support at home.
And so as an engineer, as a radiologist, you've got obviously got attention to detail, and you're able to break down complex problems. That's what engineers do.
Yes.
So what kind of complex problems are you working on right now?
So we work on the very, very complex problem of clinical language, right? That's what we do at Emtelligent. So there's so much unstructured medical data flowing through the healthcare system today, and we help people use that data in effective ways, right? It's the grandest challenge. I wake up every morning and say to my business partner, our CTO, what are we going to do today? Oh, we're going to solve healthcare language. So it's the grandest challenge of all, I think.
So tell me a little bit more about Intelligent's clinical workflow. What is that?
So it's a new product we're launching here at the show this week. And it's a user interface driven tool. So it's got a UI. It's for people to use who are dealing with clinical data. And it really is for AI assisted human review of clinical documents. So it can you can just feed it 1,000-page fax, and it will automatically split it into subdocuments, do all the OCR, label everything, code everything using medical coding systems. And it gives you all the search tools you need to find that needle in a haystack and answer the clinical questions you have.
And why is that so important right now to solve that particular problem?
It's so important right now because we're drowning in unstructured medical data in the healthcare system. If I log into an EHR system and I just have a question like, does this patient have hepatitis? I can't answer that with today's tools. And there's lots of other people in my situation. It might be someone working at a payer who's doing prior authorization. It might be someone working at an IRO doing fraud, waste, and abuse review. It could be a researcher. It could be a physician working on a patient transfer scenario who has to make a decision in 30 minutes. And so we're all doing the same thing. We're all looking for a needle in a haystack, trying to sort and organize and collate that data. And that's where AI can help us.
And when this is properly implemented, what are sort of the benefits that a practice or a clinician would see from using your tool?
Really, it allows them to really go at medical information with a scalpel, right? So you can literally just type into it, does this patient have cancer? And it's going to go, if they do, it will go, yes, they have this type of cancer, this type of cancer, this type of cancer. And you can reference it in these documents, all clickable with hyperlinks, and go to that answer.
At this point in the interview, Dr. O'Connell thought it would be really helpful to see what he was talking about. So we walked over to his booth, and he was able to give me a quick overview of the Emtelligent platform.
So this is, clinical workflow. This is our newest product we're announcing this week, and it's built on our foundation of so much work over the years to really decode medical data. So the use case here is I've just pulled up a patient, and I'm looking at their list of documents here. Now, these documents have all been we originally processed them as a single PDF file. So our document manager software automatically split out all these sub-reports, did the OCR on them, and then the documents, the output from that was passed on to our medical language engine, which converted these from unstructured medical text into structured medical data. So for example, here we're looking at a mammogram report, and we can see the procedures are highlighted in green. things which are SNOMED findings or disorders or morphologic abnormalities are highlighted in red. Measurements are highlighted in blue. So it just makes it a little bit faster for people to read. And up here, we've got a patient summary in sort of bullet point form of all the things from the patient's medical record. So for example, I see here we've got, xerostomia from a patient's SOAP note, which is a dry mouth. So, that's from oral mucosa is dry, right? That's how that was linked. We can also set up criteria. For example, this is the criteria side of it where we set up a criteria for sepsis. And sepsis, you can confidently diagnose sepsis if the patient matches these 4 criteria. And so we pre-run these criteria against this patient, and we can see for the sepsis criteria, these are highlighted in red because it meets criteria, right? The patient had an elevated temperature, elevated heart rate, elevated respiratory rate, and elevated white count. So pretty easy to, diagnose this patient with sepsis. We can also do basically like a free text AI-based search with it. Does this patient have cancer? And we're just going to search, and it's going to take a minute. We're tethering off my phone here. So it's just going to go through all of this patient's documents and the extracted data from them and combine it all and give us a very reliable output. So yeah, based on the available information, this patient has a confirmed diagnosis of squamous cell carcinoma of the left nasal cavity. So if I want to jump to that document, very easy for me to do that. Here's that document where we can see it's an operative report, and the post-op diagnosis here is squamous cell carcinoma of the left nasal cavity. So very, very easy for users to get to that needle in the haystack that they're looking for.
So tell me a little bit more about the AI component of what you're doing.
Sounds great. So we've been developing this product for years. It really is the heart of our medical language engine. And it really goes through unstructured clinical text and totally breaks it apart, understands it, codes everything, knows whether a doctor said something was present or absent, was uncertain about it, identifies all the relationships in the text. And that really is the backbone of a lot of our products today. It's this extremely high quality, very fast medical natural language processing engine using all different kinds of deep learning techniques to break apart medical documents and understand everything in them. And we use that in conjunction with other AI tools like large language models to really help people get at the information they're looking for.
Now, of course, AI in healthcare, it blends 2 things that are sometimes polar opposites. It's got data, and you've got privacy and security on the other side.
Yeah.
How do you strike that right balance between the data that you need to do, what you do, versus the privacy that patients expect?
Well, we built this product from the ground up to really have security baked into it. And so it's also possible for us to run our software completely detached from us and completely detached from the outside world within customer environments. So as some of our largest customers, they have incredibly tight security restrictions. And so they just run our software completely isolated within their environment. It never reaches out to the internet or third-party vendors, and it does everything they need it to do right there. So it can be completely firewalled off from the outside world.
Nice.
That's as a network engineer, that's the safest way to do it.
That's an important piece. So can you give us a sneak peek on what are some other things that you may be working on over at Intelligent?
Oh, we've got some really exciting features coming out in the next few months. We've got some amazing new features in our medical AI engine, our language engine. And I think we've already applied for 3 patents this year in areas around ICD-10 coding, optical character recognition, specifically for medical documents. And we've got some more patents to apply for this year as well. So really the future is super bright. And we've got an amazing team at Emtelligent who's just like spooling out all these innovations almost on a weekly basis. So it's really incredible.
Well, Dr. O'Connell, you shared a lot of great information with us today. Where can people go to learn more about Intelligent?
They can visit us at www.intelligent.com. And we're here at the health show this week. So drop on by the booth and come see us.
Amazing. Well, Dr. O'Connell, thank you so much for being on the program.
Oh, it's my pleasure, Colin. Thank you.
Hey, I really want to thank Dr. O'Connell for coming on camera with me and giving us that overview of Intelligent. Anything that can be used to improve the workflow and reduce the word burden on clinicians is always a good thing. And I really like the fact that he's a radiologist and really incorporating his technology into the workflows rather than trying to make radiologists and other clinicians conform to their workflows. And hey, if you enjoyed this video, please mash that like button and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.